I would love for you to talk to us next about what are the amazing benefits of stem cell therapy, and what are all the various ways that you use it, and where is the best evidence for use?
So the best evidence, of course, I founded an academy, American Academy of Integrated Cell Therapy. We actually have an online course for practitioners, mostly physicians, teaching them, that the science and the clinical evidence. So we actually have over 300 published scientific articles, all categorized by disease categories and organ systems, and showing them exactly in what, let's say we're dealing with liver disease, and what have been published, what has been shown. And there are actually a lot of review articles looking at, many, 10, 20, 50 studies looking at, what the benefit is for a particular condition. So there's plenty of evidence from all around the world. The research is very active. The US actually, I think, has the most research. China probably second. Japan is up there. But there's a lot of evidence. And when it comes to my clinical practice, I would say half of my practice is tailored toward people with all kinds of serious medical conditions, that most of them are desperate because they're not getting relief from the traditional medical approach, or even some have gone into functional medicine, have, done all kinds of alternative therapies, and it's still not getting them to where they want to be. So a lot of my patients are very sick. But then also there's the other half of my patients who are really well. They're very healthy. They've always taken good care of their body, and they want to stay vital. They want to continue to live this youthful life, right? We can accumulate in age, but we don't have to decline. And that's a whole purpose. So stem cell therapy also has been shown to have tremendous benefit to dial back the clock and actually prevent the aging process. And I recently gave a lecture at a few conferences specifically about stem cell therapy as an anti-aging tool. And I went into studies showing, not just looking at, they have studies like that, looking at, energy level, sex drive, 3 months or 6 months after stem cell therapy, their hair, their nail, their skin. So yes, it showed improvement. But what's really cool is that they were looking at extending lifespan. Of course, we have to do it in animals. We don't have the time to study, to see how much we extend human lifespan. So in animals, it's been pretty consistent, extended lifespan by about 30% in mice and rats. And not only the lifespan, but also health span. So these animals are looking fabulous. Their hair is shiny, their spine is straight. They know how to go around the maze. They're maintaining their mental, sharpness. So that's the other half. And well, they also showed when they looked at markers for aging, they were looking at let's say acetylcholine level. That's one thing they looked at in the muscle and in the brain, because the level decline, there's a lot of changes in, which causes muscle atrophy and also brain, functional decline. So when they give one stem cell infusion and then later on checked the acetylcholine level in both the brain and the muscles, and it showed that the levels reverted back to the youthful level. And also different growth factors went right back to the youthful level, and also the inflammatory markers, they all went back to where they were when they were young. So that's pretty powerful evidence. But when it comes to different conditions, so I would just talk about the different ways I use it in my clinic. So IV method is definitely one of my mainstay because of how powerful it is. Because our body, yes, we can put in a particular spot, but a lot of the aging, a lot of decline, a lot of the dysfunction has to do with a systemic dysregulation. Our immune system is not keeping up. So if you can talk with your entire body, then you can change the milieu, right? You're changing the whole environment. You become a more regenerative, a more powerfully therapeutic environment, throughout your body, by stimulating and balancing the immune system. But also, the cells I can put in IV have the intelligence to track where it needs to go. And I've seen that ever since my first patient, when he had rotator cuff injury, and I was only targeting his knees. I had no idea. I didn't tell me about his rotator cuff injury. It was, 4 decades old. And then it pretty much healed his rotator cuff that I didn't intend to, just because I put the cells in his IV. So that, I'm counting on the intelligence of the cells, knowing where to go. So that's a big part of what I use. But when it comes to specific areas, I do a lot of musculoskeletal repair work, like joint repair, tendon, muscles. But I also do sexual wellness, like injecting directly into a sexual organ, male or female sexual organ, to enhance sexual function. And then also facial rejuvenation and hair restoration. So all of those I've seen really great results. As far as different conditions, I would say from head to toe, they're just, from, let's say recently I treated a psoriasis patient, and she was really, really, really sick. The lesions were covering all her body, it was about to get to her face, and she was just freaking out. She was only in her 30s, and she got incredible results. I mean, this is somebody that's desperate, on, all these steroids. And so that's the skin. And then I've seen that. I've seen, benefits when I treated, patients with severe COPD on oxygen, to the point of getting off oxygen and getting off medications. I've treated a person, I remember, end stage liver disease, liver cirrhosis, and he completely recovered, with one treatment. It was to my shock. I did not, because he was in hospice, I did not think that it could turn around that fast. I mean, that to me was, close to a miracle. But the stem cells never, cease to surprise me with how powerful they are. And then I've, helped patients with all kinds of autoimmune conditions, from lupus to, rheumatoid arthritis, and, of course, psoriasis and Hashimoto's. And then I've, helped people with heart condition, with, congestive heart failure, people with neurological conditions like multiple sclerosis, dementia, ALS. So these are very, very difficult conditions. I also teach a lot of doctors how to do this. So, I do get their success stories. And I've heard, incredible success stories, with things like Parkinson's, and some, even some very difficult genetic conditions, like somebody was treating a boy, I think, with some kind of neurological condition, from birth, and the boy, achieved incredible results. So these are things that, you wouldn't normally think that it's going to help because there's something genetic. But I tell people, even if something is genetically, genetic as an origin, stem cell therapy is not gene therapy, so I can't fix the genes, but what I can fix are the downstream, damages that have been done because of genetic change. So I can help repair, the damages. So, when a condition has a significant inflammation, inflammatory component, or a significant immune dysregulation, as the pathophysiology of what's propelling the disease, then stem cell therapy has a really good chance of helping.